Hello, my name is Dr. Gauri Bhide. I'm a medical oncologist, and welcome to my site, friends, visitors, and subscribers. I'm a general oncologist in my current situation. In the past, I've worked in specialty cancer centers where everyone specialized in one particular kind of cancer. Most oncologists are general oncologists, which means that they treat a variety of different cancers. In this current explosion of new cancer drugs, it is really difficult to keep up with the remarkable progress that has been made in each kind of cancer. And when we see a new patient and we want to make sure that we are treating them with the up to date recommendations, we commonly go to one of the national guideline websites. And in the United States, that is mainly what is the NCCN, the National Comprehensive Cancer Network. How these guidelines are made is that they collect panels of experts in each disease, and the experts review all the new studies. And if there is a change or an update in the way a particular disease is treated with the advent of new information, they make changes to those guidelines. My ongoing quarrel with this entire process is that, unfortunately, the experts get a lot of funding from the pharmaceutical industry. And you can imagine, if a particular drug can make it further up the ladder of guidelines, so if you can get your drug from a low level recommendation to a high level recommendation, or from a late stage disease to an early stage disease, the number of patients that you can treat with your drug can explode. And with all these new drugs costing somewhere in the range of $8,000 to $10,000 a month, there is a lot of money involved in this entire process. A lot of studies are being financed by pharma, and a lot of the panelists are getting personal funds for speakers' fees or consultation fees or advisory boards. And it is hard to imagine that pharma would not be spending that money if it didn't get an actual return on investment. It makes me concerned when you have drugs that are fast tracked on the basis of very limited information. And that then makes it into national guidelines, and then that makes it into the accepted way of treatment, sometimes with very limited information or with very inadequate markers of success. About 20 years ago, it was actually commonplace for physicians to be wined and dined by the pharmaceutical industry in the United States. And I confess, I have gone to a basketball game or a baseball game or a dinner that was courtesy of pharmaceutical representatives. And you always told yourself that your objectivity about the drug is not going to be affected. You're going to follow the data. But in reality, the pharmaceutical industry would not be spending that kind of money on wining and dining me if it didn't actually make a difference to their sales numbers. So it is a little disingenuous to think that you were not being affected by the little perks that you were being given. To that end, I started writing a blog about 2 years ago, I think, because I was a little concerned about a particular recommendation, and I started looking at this particular aspect of follow the money. And unfortunately, I didn't have access to a lot of data, so that blog basically sat in my computer. And to my surprise, uh, in fact, this month, two articles were published which rekindled my ire. And one was in the Oncologist, which is a journal for practicing oncologists. And I've written a blog about it, and it's on my website. And the other one was I came across it in the ASCO Post, which is a news post that is put out by the American Society of Clinical Oncology. And similarly, there is a physician, an oncologist, who has written a similar post on the concern about drugs making it into the upper tiers of NCCN guidelines with inadequate or poor results. In addition, once the drugs are in the guidelines, the insurance companies then use those guidelines as a standard of treatment and a standard for payment. So it actually behooves us, the practicing oncologists, to make sure that we look at the data and not just the guideline panels and make sure that we are actually doing right by the patients. The Sunshine Act was passed, I think, in 2009. We need to have a further stricter separation of money and guideline panelists. And those are my 2 cents for today. I also blog on my website, which is www.gauribhidemd.com, and my Twitter handle is @gauribhidemd. Do subscribe and join the conversation. Thank you for visiting and have a good day.